that the data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important for a number of reasons, and I'll give you the data. It's highly significant. If you look at the time to recovery being shorter in the remdesivir arm, it was 11 days compared to 15 days. And that's a p-value for the scientists who are listening of 0.001. Although a 31% improvement doesn't seem like a knockout 100%, it is a very important proof of concept, because what it is proven is that a drug can block this virus. The mortality rate trended towards being better in the sense of less deaths in the remdesivir group, 8% versus 11% in the placebo group. It has not yet reached statistical significance, but the data needs to be further analyzed. Whenever you have clear-cut evidence that a drug works, you have an ethical obligation to immediately let the people who are in the placebo group know so that they could have access. And all of the other trials that are taking place now have a new standard of care. So we would have normally waited several days until the data gets further, dot the I and cross the T. But the data are not going to change. Some of the numbers may change a little, but the conclusion will not change. This drug happens to be blocking an enzyme that the virus uses, and that's an RNA polymerase. But there are a lot of other enzymes that the virus uses that are now going to be targets for this. This will be the standard of care. And in fact, when we look at the other trials we're doing, we were going to do a trial with another antiviral. Actually, it isn't an antiviral, it's an anti-inflammatory, a monoclonal antibody. We're going to now compare the combination of remdesivir with this. So as drugs come in, we're going to see if we could add on that.
Well, I think it's a beginning. I thought Tony explained it really well. It's a beginning. It means you build on it. I love that as a building block. Just as a building block, I love that. But certainly it's a positive. It's a very positive event.